Okay, so we're now going to do um, a brief update from Kerry. Many of you will know Kerry, who is the Chief Exec of AS UK. We're doing these updates throughout the day from around the world, so you can see what's going on kind of globally, but also, where you live. Okay, so I'll pass straight over to Kerry. Thank you, Kerry.
Hi, everyone. So many questions for Rob. I'll follow up with you, Rob, by email. Really interesting stuff there. So yeah, great to see so many people here from so many different countries. So for those of you that I've not met before, my name's Kerry Leeson-Beevers. First of all, and most importantly, I'm a mum. So I have two boys. I've got Keon, who's 23 nearly, and he's got a diagnosis of Alström. And then I have Cole, who's 16, and he doesn't have Alström. But I'm also the chief exec of Alström Syndrome UK, and another project that we run, which is called Breaking Down Barriers, which looks at addressing health inequalities. But today, I'm just going to focus on Alström. So over the past year, we've been celebrating our 25th anniversary. So there's a picture of me on the screen on the right with Keon, my eldest, we were at Site Village with a poster there celebrating our 25th anniversary, because AS UK started back in 1998. So we've been going for quite some time now. So this is our team. We're very fortunate to have, to get quite, different various funding streams in through AS UK, through our contract with NHS and through Children in Need and through Breaking Down Barriers funding. So we are fortunate to have paid members of staff within our team. So these are some of our care coordinators, transition coordinators. Obviously, we've got Catherine and Anne on there, and Marie as well. But they're also our board of trustees, and we're very fortunate to have some volunteers as well. So this is a map of UK patients. So this map comes from when we did our audit in March 22, where we had 86 people. We have had new referrals. Since then, we've now got 93 people. So on the map, you'll see that we've got people right down at the bottom of England, right up to the top of Scotland, and then some clusters in the middle. So we have some clusters in the south, in London, and in the north of England as well. We know how fortunate we are to have a highly specialised service. Sadaf mentioned the clinics earlier. So we have paediatric clinics and adult clinics. We know not every families are fortunate to have these clinics in other countries. So that's why we share as much as we can, and we contribute to clinical guidelines and things so that people can learn from their experiences and hopefully use that to at least share with their clinicians in their own countries as well, to make sure that people are getting the monitoring and things that they need for Alström. But we have two care coordinators in the UK who support families at clinic, and we have a very close working relationship with the clinical team. It's very much a partnership to deliver those highly specialised services. And we do get involved in research where we can. We always try and make sure that all of the information that the researchers and the clinicians learn within clinics is shared with people with lived experience, but also that the people with lived experience contribute to the research that's been done, and that the doctors can learn from that lived experience, really, to make sure that research and the services we developed are based around what families living with Alström need. We've had an active year, so we got back to do our first residential this year. So a group of young people went to Whitemore Lakes. They went abseiling. They jumped. They jumped off high towers. They did all sorts. They did canoeing. It was great to see people coming together and really pushing themselves. So we do a lot around grants and things like that to get people active, because we've heard how important health and healthy weight, healthy diet and exercise is. So if we can provide grants for treadmills, gym memberships, things like that, then we'll always try to do that. We also make sure that people are getting the right assessments that they need. So they're getting access in the UK to something called direct payments, which is like a personal assistant, so that people can get out and about and aren't just reliant on family members. They can access support from others as well, to access the community and to do the things that they enjoy doing. And we also support people to put together person-centered plans, because we really are the kind of centre to be able to support, to bridge that gap really between families living with Alström and health education, social care. So we make sure that people are getting the right support and things that they need. And this year we've developed the TCASH resources. We were able to share this at the ASI conference in America, which I thoroughly enjoyed. So these are some resources that we've developed to support people going through the transition process. So, you know, we firmly believe that transition is not just about moving from the pediatric clinics to the adult clinics. It's much more than that. It's about, you know, young people from around the age of 12 looking at as they grow into adulthood, looking at the skills and confidence and things like that can be developed. But it's also looking at how can we support healthcare professionals to support young people through that journey. So we've got a range of different resources and things on our website that you can access, and those resources can be used wherever you are in the world. So an organisation we've been working with took those resources to America, and they've been used there. So if you are interested in finding out a bit more about transition, then please do get in contact. The final slide on AS Global is to please remind people about the patient registry and to ask you to please complete that. You know, the global community has been fascinating. As I said, great to see so many people here from so many different countries. It's an opportunity to provide regular webinars, to provide this virtual conference, and to find ways for us to all collaborate, connect, and learn together. I think, you know, we all have a role to play. People with lived experience and families have so much to bring to the table. Researchers and clinicians can learn so much from us, just like we do from them. So it really is that partnership. So if you're happy to share your experiences and share your symptoms and things on the patient registry by getting a real good picture of, you know, Alström around the world, I think that's what's going to help us to really push things forward in terms of research. So final thoughts is, you know, there is no one size fits all. I think, you know, we all have so much in common with Alström, you know, but we all experience things very differently. So I think what we try and do in the UK is really to provide that personalised support and to adapt to individual needs. And just to remember that actually mental health is as important as our physical health. And I know that Melissa's going to be talking about that a little bit later on today. So yeah. Lovely to see you all, and please do get in touch. And we've got our in-person conference, our first in-person conference in the UK in October, so everybody's welcome as well. Thank you.
Perfect. Thank you very much, Kerry. And they're quite extraordinary, really, when you do look back, you know, not dissimilar to ASI, is that, you know, ASUK has been going for 25 years. And so, you know, the learning over that time and the changes have been quite phenomenal, really.